as a part of the integrated social service governance model aftershock of OECD. And we are organizing this event in collaboration with Sultanbeyli Municipality, Maltepe Municipality, Argudan Governance Academy. So we all know the situation we have faced with COVID, and we have all learned that all our lives are intertwined. So during disasters or shocks like COVID or others, there have been researches about how integrated social service can be provided, and we will be talking about this project today. Argudan Governance Academy has collaborated with Sultanbeyli and Maltepe municipalities, and it was not an interpretation of an existing project, but it was more of an authentic, original project that was created. And here we have our publication, which was published today, actually, related to this project. And our friends will probably provide information to you about how you can access this publication. So, first of all, I am Cemil Arslan from the Marmara Municipalities Union. And maybe some of our foreign guests may not know about our union, so let me briefly explain. We were the first local government union established in 1975. So urbanization, migration, sister cities, relationships between cities, we have been focusing on that, and we have been working to enhance collaboration between various municipalities. And Maltepe Municipality and Sultanbeyli Municipality are two very important municipalities of Istanbul. And quite coincidentally, I must also add this information, we also have the best local government applications award that we give out. And this year we had a very small number of amounts, but Sultanbeyli in the area of immigration and Maltepe in the area of transportation and mobility will be receiving awards tomorrow. So Sultanbeyli municipality has become a very important example across not only Turkey, but across the world in terms of immigration. And first of all, I would like to hand the floor to our Sultanbeyli mayor and then our Maltepe municipality mayor. And after that, we will have our friends from the Sultanbeyli and Maltepe municipalities and our friends from the Argudan Governance Academy throughout our panel discussion. And I would like to say this as we start. Now, mayors are very busy in their regular day-to-day lives, and with COVID, they have become increasingly busy. So our Sultanbeyli mayor, Mr. Hüseyin Keskin, may have to leave after he gives a speech, and he is attending from another district already because he has a very busy schedule. And I would like to start with Mr. Hüseyin Keskin, the mayor of Sultanbeyli municipality. I think your microphone is muted, sir. On the left-hand side, there is a microphone icon, Mr. Mayor. If you could click on that and unmute yourself. Yes, now it's on. Our distinguished moderator, our distinguished deputy mayor, distinguished participants from municipalities, esteemed representatives of Argudan Governance Academy, dear guests, I would like to cordially greet you all. And I would like to thank the Marmara Municipality Union and Mr. Cemil Arslan for organizing this event. And as you mentioned, we are going to be together tomorrow for the award ceremony as well. And I would like to thank all of our colleagues for supporting us in achieving this award, and I would like to congratulate the Maltepe municipality as well. And today, the uncle of the mayor of the Çekmeköy municipality passed away, so we attended the funeral, and that's why I'm attending from their district. I'm sorry for arriving late. So when we look at our topic and when we focus on how we performed throughout the COVID era and what we are doing for further development, I would like to say a few things. 2 days ago, together with all of our team and all of our managers, we actually had a presentation about this, and we had the chance to evaluate how we can move forward. Now, COVID-19, the pandemic, has had an impact across the entire world, and it has had a significant impact in daily life and business life. The economical, social, and psychological impacts of the pandemic led to the citizens having different needs, and their expectations from service providing institutions changed. So, for that reason, as institutions that are in close contact with citizens, municipalities really need to be able to adapt their institutional capabilities. And in this process, as the Sultanbeyli municipality, as part of our activities, we prioritized the necessities, and we developed a strategy to meet the urgent needs of our citizens. And we took care of disinfestation services in our municipality, and we provided personally protective gear like masks and disinfectants to our citizens. And our call center worked on rapidly gathering the needs of our citizens, and we provided ambulance support, and we also provided hot food services to risk groups, and we sent hygiene packages, and also cleaning and renovation services were provided. And we also had billboards with warning about the pandemic, and we also had posts on social media to provide information, and we had some audits in the workplaces of our municipality. And for children and youth, we try to support their educational life, and our courses were carried onto the online environment. And our cultural activities like panels and discussions were also done in the online environment. And for the children to be able to adapt to this new environment and to increase their awareness about hygiene, we gave out a box game focusing on hygiene to 2,000 households. And we kept in contact with public institutions and NGOs, and we tried to keep the governance models active. And we also supported logistics support to many public institutions and NGOs. In this scope, we also provided some driver and vehicle support for contact testing applications in our district. And again, yesterday, with all of our district municipalities, we evaluated this process, and all of their means were mobilized throughout this period. And we are hoping that we can soon be freed from this virus, but also we are hoping that we get good learnings out of this. And also, together with our strategic development directorate, we worked on our R&D activities as well. And we also tried to discover the newly emerging needs in our district. And we had a 6-step field research about this, and the teams I would like to thank them once again. And according to the data collected from this research, we discovered our main opportunity areas: crisis management technology, personnel management, data management, financial management, participation at the local level, health, social support, education, and awareness raising are the areas of priority. And we are trying to focus on serving the SDGs through this as well. And we are aiming to create a more sustainable living environment in our city. Now, in the areas of development that we discovered, we also have some activities that we are undertaking, and an effective crisis management approach. Being prepared for crisis can have an impact on the outcomes of the crisis in terms of mitigating the outcomes of crisis. So we had some rapid planning at the beginning of the pandemic and quickly implemented the required projects. And we also defined the actions that were required and implemented them as soon as possible. And online schooling, online shopping were areas that increased. And that's why technology became a critical infrastructure. And we focused on expanding the scope of our online program coding activities and try to accelerate in that area as well. And the public institution personnel also need to adapt to the rapidly changing conditions under crisis circumstances, and our personnel need to be able to be rerouted in such situations. So we made preparations for this as well. Now, when we worked with universities, especially before we worked, it was the Gebze Technical Institute, now it's the Gebze Technical University. We had worked with them, and the first thing that was revealed, and it's probably a picture that would be revealed in all municipalities, it is the lack of coordination between different units, because each department or each directorate perceives themselves as an authority figure, and they try to make sure no one else interferes. So actually going through these phases and having collaboration in place and having rerouting of personnel really helps break down those walls. Now, financial sustainability policies were also implemented, and we managed to have a balanced budget. Now, as Sultanbeyli municipality, we don't have such a high income compared to Maltepe municipality or other municipalities, but we are one of the few municipalities that didn't go into borrowing throughout this process, and we really worked on this within our institution. And we tried to increase our financial resilience. And for that, we worked on projections and alternative budget plans. These are also areas that we prioritize. And all stakeholders, all local stakeholders need to be more effective in decision making for local policy making. And with the vision of inclusiveness, we worked together with the NGOs and public institutions, and we tried to increase the participation at the local level, and we worked with our neighborhood or district Mukhtars, so we can increase participation. Now, of course, this process that started with the immigration wave, we made sure we had workshops throughout that time while we were creating our refugee centers. So as Sultanbeyli municipality, we know that throughout times of crisis, we shouldn't act on our own, and we should be in contact with all rated institutes and all NGOs, and that proves positive results. So throughout the pandemic, we worked on protecting public health, and with the support of our municipality, we had personally protective equipment produced in our district, and we also gave out hygiene certificates to workplaces that went through our audit. And the conditions revealed by the COVID-19 pandemic made the disadvantaged groups more open to risk. And health care access we believed should not be disrupted throughout this time, and we provided support in this area. And also to prevent repeated social aid, we are working on a structure to have a single center managing the social aid provided. And we are focusing on psychosocial support for vulnerable groups throughout crises. And we are working on conducting these sessions online, and we are working on restructuring our call center as well. In times of crisis, creating awareness across the public is one of the important responsibilities of public institutions. So we also need to provide support in terms of economic crisis management towards enterprises. And we are making plans towards that as well. And besides this, we need to develop innovative communication strategies to have effective communication with our people. So these are the top items on our agenda. And that's all I want to say for now. As Sultanbeyli municipality, just like our other municipalities, in times of crisis, for example, we had the Izmir earthquake recently, and hopefully we will never experience the Istanbul earthquake, or we take really good measures for that. But at times of crisis and before crisis, as Sultanbeyli municipality, we are preparing because we believe that these preparations are very important. And I would like to thank all of our colleagues, all of our stakeholders, representatives of the Argudan Governance Academy, and our stakeholder Maltepe municipality, and also the Marmara Municipalities Union, who have been working in this area significantly. I would like to thank all of you, and I would like to greet all of the participants. I will be here for a while, at least let me hear our Maltepe municipality, and then I'm going to ask to leave because I want to be with our friend during the funeral. Thank you very much, Mr. Mayor. You talked about sustainability, inclusiveness, coordination, and participation. And I guess during the panel, İnan İzci and Erkin Erimez from Argudan Governance Academy will probably emphasize the importance of these aspects as well. But I guess in municipalities, leadership and political leadership is also very important for teamwork to be led efficiently. And I guess at the Sultanbeyli municipality, there are many achievements that have been recognized worldwide, and you have a good team. Yes, we have a very good team. And also the leader of that team needs to support that team. I think that is very important in your case as well. Thank you very much. And thank you for sparing time for us. And before moving on to the Maltepe municipality, there is something I forgot to remind you of. Now, our foreign guests can listen to English from the interpretation option. And also, we have the chat box here, and both we can receive both your comments and your questions through the chat box. And if you have any opinions you want to share with everyone, you can share your opinions with everyone, but you can also privately send messages to specific people if you need to. Thank you very much. Now I would like to leave the floor to the Maltepe Deputy Mayor Salih Kara. Maltepe municipality is the second stakeholder of this project, and they are also yielding very good results. And we will hear from them in the panel as well. But now I'd like to leave the floor for the opening speech. I must say this as well before I leave the floor to Mr. Salih Kara. Now, of course, we have experts of this topic here. I actually called Mr. Mehmet and said, thank you for creating this speech for me. I actually skipped some parts because I said, if I go into all of these details, what are you going to talk about in the panel? So I tried to shorten my speech a little bit. But I mean, in the opening speech, I could have just said, hello, thank you, congratulations. So I'm sorry if I took too long. No, thank you very much. The floor is yours, Mr. Salih.
Well, I'd like to extend my greetings to all my peers and colleagues, and I also would like to congratulate everyone who exerted efforts for this organization. I also would like to extend my greetings to the army of healthcare workers. They're working hard to combat this pandemic, and may they live long so that we can live long on this planet. COVID-19 was an unprecedented and unexpected development and process. It was unexpected for us, it was unexpected for the rest of the world as well. In such a situation, it's not easy to manage this crisis because we are confronted with a threat which was unprecedented, as I told you before, and we didn't know how to handle it. I don't need to go into technical details because they will be provided by my colleagues further on. But throughout this process, the expectations and needs and concerns of people have changed direction. Therefore, as municipalities, we had to change the course of our services. Because what people feared most was their lives, the safety of their lives. Healthcare professionals, in terms of flexible working hours or remote working, they did not have such a luxury. And same went for the people working for the municipalities as well. We did not have the luxury or option to work remotely or on flexible hours. And of course, people had very high expectations about cleaning, about veterinary services, social services, and other municipal services. Their demand for such services increased very much, and people became more careful about hygiene and cleanliness, including my peer mayors here and everyone else who work for a municipality know it very well that municipal waste increased by 50%, household waste increased by 50%, and streets started to become dirtier actually throughout this process. I'm an agricultural engineer by profession, and I combated viruses in plants and animals. Now doctors are fighting this virus which affects human health. And so far, what we have done on the medical field proved to be right, but we also have to pay attention to hygiene conditions in the environment as well. We have to keep everywhere clean so that people do not get contacted with the virus. So people have different expectations now, and we had to divert our course to meet their expectations. Some people lost their jobs because of this unprecedented threat, and some people had to suffer a lot to sustain their lives actually. And some of our staff members were in a very difficult condition and they were too shy, too embarrassed to ask for help. We had to go and find them. And we had to change our action plans as well, because in the end, people working for us are human beings, and they face the threat of being contacted with the virus, and they got the virus. So we had to quarantine some of them, and we had to change and amend our action plans accordingly. And sometimes it was difficult for us to explain the situation to the rest of the community. You know it very well from your experiences as well. You sweep the streets all the time, but someone comes and puts trash on the street, and it looks as if the municipality is not doing its job. But it's not. It's not the case. As municipal workers, we have to be on our duty 24/7 to keep on providing services. Sustainable urban resilience. To achieve this, we had this great opportunity actually, and this COVID pandemic gave us this opportunity. Yes, indeed we faced challenges. Yes, we lost lives, but in the upcoming period, we have to be ready for other disasters, and COVID-19 taught us how to be ready. Just like the previous speaker, my colleague mentioned, we had to deliver services which were not defined in our terms of preference. We cleaned everywhere, starting from taxi stations to bus stations to prayer houses and schools. I mean, you can name anything. We distributed toilet papers and all other different materials and supplies, which were not under our mandate. Why, you may ask? Because in such circumstances, people's first door to knock is municipality. So they wanted the municipality to be the first authority to meet their needs. This has become an important priority for the municipality, actually, and this has become a handicap for us as well. Municipalities are also in charge of enlightening the citizens, informing the citizens. In fact, all institutions and organizations of the state worked hard on informing the community, but when we look at what has been done, in spite of all the information raised by public authorities, people, citizens, still seem to be ignorant, actually. But God gave us reason, God gave us ways of thinking, but God also gave us a certain period of time on this planet, so we have to work our reason to understand what we should do as people. So we didn't receive much contribution from the people's side, actually. Healthcare professionals are working really hard. They leave their families behind to go and fight the pandemic in the hospitals. And we, municipal people, go and control and audit workplaces. We warn people so that they pay attention to social distancing rules. They should wear a mask. We kind of warn them. They say, okay, I'll do it. But when you look back in 2 minutes, you see that he's still not wearing the mask or they're not obeying the rules. So these are challenging tasks for us. Yes, maybe we should be more involved with the community. We should spend more time within the community, mingling with people. I think that's a lesson to be learned. In building our plans for the future, I think we should get more feedback from the people so that we can find better ways to fight such disasters and take preventive measures. Of course, we also have to think about the financial cost of such measures. Naturally, our revenues are falling. State is unable to collect taxes, and when the state cannot collect taxes, they cannot allocate us the money that should be appropriated to us. And we depend on money coming from the general budget, and we also depend on the taxes we collect from construction projects. So we have limited resources actually, but despite the limited resources, I think we fought a good battle against the pandemic. I'd like to close my remarks now. I'd like to extend my greetings to each and every one of you once again. If needed, I'll speak during the panel as well. Well, thank you very much, Mr. Kara, the mayor of Maltepe. Starting from the municipalities, I think all the institutions in Turkey are highly capable in terms of resilience. That term in Turkish, that term, resilience, cannot be translated directly into Turkish. It is translated as flexibility or being resistant. But I think the municipalities and all other public institutions in Turkey prove that they are resilient institutions and they're working really hard to fight this pandemic. I think we already got this message from the speeches of two mayors. Now we continue with the panel session. We have four valuable speakers. Unfortunately, I don't have time to introduce their biographies, but I'd like to introduce them with a couple of sentences. We have Mr. Inan İzci from Arguden Governance Academy. He is a local government expert, and he works on governance, development, local financial management, both nationally and internationally. He had previous experience in the private sector, in the public sector, and in a municipality, so we can call him an expert on municipalities as well. He took part in several projects of the OECD and the United Nations. He addressed the crowd in major organizations. We also have Mr. Erkin Erimez, again from Arguden Governance Academy. He is the academic board member. He worked for Borusan Holding for 23 years. Those of you from Istanbul know it very well that Borusan is a large institution supporting culture and arts in Turkey, Istanbul. His main field of activity was strategic development, governance. He's currently teaching fundamentals of corporate sustainable strategy in Boğaziçi University MBA program. And he has a grading certificate as well. Our third speaker on our panel is Mr. Mehmet Aktaş. He is the Strategic Development Manager of Sultanbeyli Municipality. Mr. Aktaş graduated from French public management. He is currently working on his postgraduate studies on urbanization and children. Immigration policies, social policies, EU relations, and strategic planning are his other fields of activities. He delivered important presentations in meetings, both nationally and internationally. And our fourth speaker is Mr. Bahadır Keşan from Maltepe Municipality. He is an urban planner. He also has an BA in urban planning. He is a strategic development manager of Maltepe Municipality. He is working on two important concepts of utopia and dystopia. Since 2011, he is also working in the municipality as an actor in the municipality theater. He's also designing the stage as well. So one day I hope to watch his play online, live. So we'll start the panel now, and I kindly ask each speaker to complete their primary remarks within 8 minutes. Let's first hear from you about the institutionalization of this project in your municipalities. But before that, I'll turn to Hüseyin Bey. Well, I'd like to apologize from our panelists. I have to leave now. I'm really sorry to be leaving actually because we have a great deal to learn from our professors. I was planning to stay till the end of this event because we are in great need of learning. But as I told you, I have to attend the funeral, and I also have to leave for other duties regarding the pandemic. So please forgive me. And I'd like to thank you very much for organizing this event. And hopefully tomorrow we'll be seeing you. Maltepe Municipality is a stakeholder in Istanbul 95 project as well. So we'll be seeing more of them.
Have a good day, Mr. Mayor. Thank you very much. Now, Mr. Inan Izci, can you inform us about the importance of risk governance for resilient local governance? So you have created a tangible project, and this has turned into a publication. We showed this at the beginning of this event as well. So can you briefly inform us? I know 8 minutes is not enough, but if you can summarize. Yes, thank you. And first of all, I would like to thank everyone who contributed to this activity. And Mr. Cemil Aslan, you and the Marmara Municipalities Union's contributions have been very important for us. Now, of course, I can touch upon risk governance. Now, of course, the concept of governance is used in many areas, but when we talk about resilient cities, as you said, it is about being flexible and resilient against various shocks and crises. Now, of course, an environmental infrastructure, the organizational structure, and the governance structure is important here. And normally it was focusing on natural disasters like earthquakes, but COVID-19 showed us something when we look at history, the a plague, for example, showed us the same thing. And that is the fact that pandemics are also disasters or shocks. And cities need to have an approach towards these shocks. So in this context, resilience consists of defining various risks and planning scenarios, evaluating those scenarios, and including the stakeholders into the decisions and being prepared, basically. So in this study, what we focused on the most, now, of course, COVID-19 was not a natural catastrophe like fire or flood or earthquake, but it was even more powerful and it impacted the entire world. It went all the way into households. And what we witnessed here the most was, first of all, the elderly living alone or those with chronic diseases were facing the risk of death, basically. And at that point, municipalities, in terms of being the democratic local government structures of the city, became the application point. And of course, we then came up with the concept of risk because there's, when we think about risks, it has a 360 degrees approach. So we said we should focus on risk governance for resilient cities. So what is risk governance? Now, it is about evaluating various dimensions and including institutions and considering citizens and going into a state of preparedness. So the elderly, for example, that are living alone or that require care, we focused on the need for planning and execution for their needs, like who would go to support them? Or should we be able to find these elderly people in need before they find us? How many people in the district are elderly living alone? And how many of them do we need to approach before they can find the means to approach us? And also nutrition, the psychological dimension. There were some people who were challenged psychologically because it was the first time they were facing such a situation. So we took all of this into account and we wanted to create a model based on this. And with the leadership of Sultanbeyli and Maltepe municipalities, they really supported this suggestion, this proposal we had, and we started to prepare this together. So we had a good governance model in mind. And what we focused on was, now, if you say good governance, then you need to develop a model in line with that. So first of all, we conducted household-based researches, and we had phone calls for these surveys with 2,259 households, and not just households, enterprises as well. So the enterprises reproducing economy, basically, and this was important for employment and income as well. So we also conducted surveys with 825 enterprises from both these municipalities. And we evaluated the crisis together with the personnel from both these municipalities. Again, we conducted surveys for the municipal staff, and we also had in-depth interviews with the executives at the municipalities. So in this way, we managed to define the weaknesses and the strengths and the opportunity areas. And that wasn't all. We also focused on various institutions and NGOs in those districts, and we had some studies that we had with the stakeholders as well, basically consultations. And of course, there was also the experiences across the world. So we evaluated the literature, we looked at best practices, and of course, at the end of the day, we all know that municipalities say legislation. They will say, is that part of my mandate? Must I do that? So then we try to look at this translating into the legislation. And when we look at it, yes, pandemic is mentioned in various areas in the legislation in terms of shock and aftershock services. There are various citations in legislation as well. So we do have some sort of sensitivity towards this. So after that, after all of these surveys and interviews, we try to look at what we need to do at the administrative level. And together with this, again, as part of the good governance model, the decisions needed to be based on data and it needed to consider the stakeholders. So the district municipalities and the NGOs had to be included as well. And we also had to find the areas where we could most efficiently use our resources. For example, within municipalities, we noticed that some staff working was risky, and that's why we had to redirect personnel from department to department. But because they didn't have laptops and they were using desktops, it became a challenge. So when they had to work at home, it became a huge challenge. So we discovered that during the supply phase, they need to focus more on purchasing laptops. So in the end, basically, taking various risks into account while making decisions and making sure these are in line with the legislation and considering the activities to be undertaken by various directorates were all part of this plan. And this can be found in this publication as well. So planning the processes and implementation was all tackled as part of the project. And I think my time's up. So thank you very much. Thank you for abiding by the time. And I guess there's nothing left for the moderator to say when everyone is time sensitive. So now I would like to turn to Mr. Erkin Erimez. As far as I can see, and I guess it is expressed in this booklet as well, there are two very important pillars of this integrated social service governance model. One is data collection from municipalities, and secondly, reviewing world examples to create an authentic model. So I would like to ask Mr. Erimez, what do you think about the experiences created across the world with this crisis? Can you inform us a little bit? First of all, I would like to thank the Marmara Municipalities Union for creating such a platform for us. Now, first of all, this crisis that we are undergoing is, yes, something that has been experienced before, but never at this scale. So, was there an expectation for such a crisis? No, when you look at it. But when you turn to 2019, WHO did mention that there was a pandemic risk and that it would be about pneumonia. So they said, be prepared. And there were many warnings, and many countries had worked on this. However, the crisis showed us that all of these studies were not sufficient. We had to be better prepared. So in terms of public administration, when you look at it, preparing for crisis is as challenging as managing the crisis. Because when you are preparing for a crisis, you are basically spending your resources for a crisis that you don't know when will happen. So it is quite hard. It is quite hard to express that you are allocating your resources to something in the long run. But the citizens actually need to see that their life and their assets are safe in the present time. Now, secondly, when we look at the world, first of all, when all of these studies that I mentioned are being conducted, of course, many examples show us that having an holistic or integrated approach is very important. From Canada to USA to south of Europe, Asia, we went through many studies. And after the 2020 COVID crisis, especially in some areas in Canada, there were revisions about crisis management activities, and we also reviewed those. And we were inspired by them as well. But the activity that we carried out should not be deemed as an adaptation of these studies, because as it was previously mentioned, we tried to take into account the realities of the field as well. And the strategic development directorates of two municipalities supported us in terms of collecting data from external sources and also internal sources. And we collected significant data. And in the light of this data, we try to blend the existing model with this data that we collected, and we try to create a model unique for us, but that could also be implemented in other parts of the world. So in that sense, when we look at it, there is the preparations before the crisis. And when we talk about preparations, it's preparing human resource, preparing the society, and then being resilient and flexible during the crisis, taking accurate decisions and acting quickly. These are all very important, but it's not over. After that, the impact of the crisis needs to be assessed, and there needs to be remedies provided because it doesn't end overnight. We see this in crises all across the world. Now, currently, the entire world is undergoing the COVID crisis, but this health crisis is transforming into an economic crisis, as we can all observe. So, on the other hand, when we look at the developments across the world, the London School of Economics, UCLG, and Metropolis have a collaborative study that they are undertaking, and they published 3 documents about the study in July 2020, and we observed that they focus on 2 subjects. One is about political governance, the challenges faced by local governments in this sense, and it is quite interesting what they find here. It is done with 58 municipalities and 35 countries, and Europe, Africa, Australia, America, there are local governments from all these areas. And what we observe is this. Now, first of all, the authorities of local governments or their mandates require some collaboration with the central government. And it is revealed that it is very hard for them to take certain actions without collaboration with the central government. And also, the local governments, although they are in contact with stakeholders up to this day, throughout this crisis management, they notice that they have not had enough interaction with their stakeholders, specifically in this area. And as the Deputy Mayor of Maltepe mentioned, people are not sensitive enough about complying to the measures taken. And this is something observed in all geographies. So when we look at another dimension of this study, they also conduct a research about the innovation areas, and we see that municipalities are working on improving their capability to create solutions, and there is an increase in inclusion and there is an increase in investments for data collection. But another issue that we see here is the financial processes that we mentioned. In terms of financial processes, unfortunately, all across the world, we see that there aren't enough innovative studies. And since this crisis is an economic crisis, as I said, in terms of social aid in municipalities and local governments, there is a huge burden. So this is from service planning to modifying investments. It is a huge scope. So it is important to have innovative studies to create resources. Now, again, legislation is probably a very important topic here. And in this sense, they need to contact the central governments as well. And they also need to turn towards alternative resources. This could be NGOs. For example, there were some cases in Istanbul and Ankara where the bills that could not be paid were paid by citizens. The municipalities announced them and the citizens helped support other citizens. So the social resources were mobilized. And these innovative approaches should not just be part of crisis situations, but they should be more long-term. This is basically the picture that has been revealed in Turkey and across the world. That's all I'm going to say for now, and hopefully in the second round, I'll add more. Thank you very much. Now, of course, there are manageable risks and unmanageable risks. As Mayor Salih mentioned, for example, they have a healthcare official at home and also a municipality official at home. I guess that is one of the most challenging risks to manage. I mean, in your household, the risk was really big, wasn't it? Yes, that's true. And also, I have a 7-year-old son at home. And the law says mothers or parents with children below the age of 10 can ask for a leave, but neither the mother nor the father could ask for a leave. So that was the situation we were in. Okay, so now let's turn to our friends from the municipality. The model can be flawless, but still it needs to be developed in the field and it needs to touch the lives of people. And we have 2 very distinguished strategic development directors. Now, I would like to ask the same question to both of you. First, Mr. Mehmet Aktaş, and then Mr. Bahadır Keşan. This experience of COVID-19 and the research findings of this phase, can you share those with us? And if you can share the tangible information, it would be very beneficial because there are some viewers who don't know Turkish among us, so please let's try to make it easy to understand for them.
Ben de çok teşekkür ediyorum sizlere.
Thank you very much, Mr. Aslan. I'd like to extend my greetings to the panelists and also to the participants who are listening to us now. Indeed, within the last 5-6 months, we had frequent contacts with you and with Argudan Governance Academy and all the stakeholders who are involved in this project. We worked really hard together. We cooperated in a great manner. And I think we have to emphasize the importance of the unity and the solidarity among us as well. Our mayor already told us about the general responsibilities of our municipality, but I'll be talking about our research and development activities in particular within the pandemic period. And finally, I'll try to explain as briefly and as tangibly as possible the results of the research process. Within the scope of the study, we attached great importance to some definitions. Both before the research and after the research, we thought about how we can use these concepts in our practical work. The first definition I'd like to mention is transparency. Transparency is very important, and it became even more important in this process as well. Another concept is participation and a participatory approach. You have to make sure that all your processes and management systems are participatory so that more stakeholders can get involved in the decision-making processes. If you have data, then you can manage the process in a meaningful manner. But without data, you just have to play it by the ear and you have to depend on projections. So you have to rely on data. Being inclusive, United Nations says you have to leave no one behind. As municipalities, we should leave no one behind as well, including immigrants, refugees, and people with disadvantages. So we tested these concepts. You have to be transparent, you have to be inclusive, and we also worked hard so that people around us adopt these concepts and principles as well. At the beginning of the pandemic, we also tried to research about what other municipalities around the world are doing at that moment to handle the consequences of the pandemic. We shared the results with the senior management of the municipality. Then we turned to Turkey to see what the other 30 greater municipalities are doing, what kind of activities they're carrying out, and how they adopt their processes to the pandemic. That was another research we conducted. And finally, we looked at Istanbul in particular, and we conducted a research about 39 districts of Istanbul. In this study, we looked into how the individual municipalities within the 39 districts are acting against the pandemic and what kind of activities they're conducting. And we prepared a report of our results as well. So this gave us information, cumulative information about what is taking place around the world and within Turkey in particular. As I mentioned at the beginning, we had to make sure that all our processes are participatory so that we take right measures and right decisions. To achieve this goal, every week we collected data from different units of the municipality about their activities on COVID-19, and all units were given a deadline to submit their data to the headquarters, to us. We classified that information as quantitative data and qualitative data, and we issued weekly reports about COVID-19. And that allowed us to make comparative analysis about past weeks as well. So we use the data to calculate the progress we achieved in the municipality. Later on, in order to identify the needs of the community and to plan our activities accordingly, we started analyzing data from the call center and from the other units as well. But we soon understood that all the needs had to be clearly identified so that an effective action planning can be made. But this required more field work, more field research. As my mayor said at this presentation, Sultanbeyli municipality organized a 6-phase research study. It was a field study. Within the scope of the study, we conducted questionnaires among the workplaces and households, and we also conducted interviews for corporations. İnan Bey gave us some cumulative data about certain municipalities. In Sultanbeyli, we managed to reach out to 404 workplaces, 1,050 households, 2,000 employees, and 20 external stakeholders, 5 of them being NGOs and 12 of them being public institutions. As a result of this study, let's look at what kind of basic observations we achieved. In general, in our municipality, we have a lot of SMEs, and most of the households are from the mid and low income group. Therefore, our district got affected highly from COVID-19. And we have a high rate of young people, therefore, the general number of people affected was not very high. But in terms of people with chronic diseases like asthma and diabetes, we have a very high rate. Therefore, they were affected the most. Technology, textile, and media were the 3 major sectors which were affected by the COVID-19. Under the technology sector, internet cafes, computer shops, phone repair shops, and other similar technology shops were affected highly from COVID-19. And under the textile sector, tailors, garment shops, and other suppliers were affected. Under the media sector, photography studios, wedding halls, tourism agencies, printing houses, and logistics companies and other tourism companies were affected the most from the COVID-19 pandemic. And as you know, hairdressers and barbershops were shut down during the pandemic. Therefore, they should be included in the list of workplaces with the highest impact of pandemic. Of course, some workplaces benefited from the pandemic. Their income has risen. In general, the construction sector was affected negatively, but under the construction sector, there are some subsectors like decoration, interior design businesses, or hardware businesses. Their incomes increased, and of course, grocery stores and other supermarkets increased their revenues during the pandemic. In our district, the majority of workplaces are family businesses. Therefore, not many people got fired or lost their jobs. Only 14% of the workplaces stated that they had to let some of their staff members go. And the main reason behind this low rate is because most of the enterprises are family-owned enterprises. And looking specifically at households, could you please wrap up, please? Yes, of course. More than half of the households lost their revenues, and more than half of the households applied for benefits 2008. And Sultanbeyli municipality was the top of the was at the top of the list in organizations providing support for households in need. Well, thank you very much for your attention. I have more to say, but I have limited time. Well, thank you. Whatever you've provided so far are very concrete and very informative. Thank you. Now we'll continue with Mr. Bahadır Keshan, the Strategic Development the Director of Maltepe University, Municipality, excuse me. I'd like to ask you the same question. Could you please talk us about the COVID-19 process and the studies that you've conducted? Your municipalities are neighboring municipalities, almost neighboring municipalities. Maybe you can complement what Mr. Aktaş already said. Well, thank you very much. I'd like to thank our mayor for his contribution. I also would like to extend my greetings to Mr. Aktaş, Mr. İzci, and Mr. Erimez. We've been working hard with them. We've been meeting with them frequently. Whenever the phone rings, I immediately think whether it's Mr. İzci or Mr. Erimez. So it's a great way of working. My master's degree thesis was about future cities or cities of the future. I described three cities. One is dystopia cities, science fiction cities, and disaster cities or disaster-struck cities. I tried to look in my thesis how such concepts were handled in literature, in movies. And one of the concepts I looked into was biological pandemics, and to make fun, I looked at zombie attacks actually, but of course it has nothing to do with COVID-19 pandemic. I think from now on, pandemics of COVID-19 and similar pandemics will be a topic to be further discussed. Well, without further ado, I'd like to start presenting our research process. As an institution, just like Sultanbeyli municipality and other similar municipalities, we were caught unprepared. At the beginning, we tried to work from home. We tried to communicate with the rest of the professionals over WhatsApp. So for the first 2 weeks, we didn't know what to do because we didn't have much data at hand. And just like the previous speakers said, the Ministry of Health did not know how to find and extract data or produce data. And we depended on data coming from the Ministry of Health. But of course, data coming from the Ministry of Health were national data rather than district-specific data. So we didn't have much data at hand at the very beginning. That's why it was very difficult for us to plan our next steps. So seeing that problem, we decided to collect more data. I'm not going to repeat what Mr. Aktaş said. Just like Maltepe municipality, we also conducted research among workplaces and among households. We talked to 421 workplaces. The numbers are higher than Sultanbeyli because our population is almost double than the population of Sultanbeyli. So we had to extend our sample size to have an accurate result from the studies actually. That's why the numbers are very high. So in terms of loss of turnover and revenue, 82% of the workplaces that we interviewed with lost monthly turnover to a very high degree. So just like Sultanbeyli, Maltepe municipality was struck from this pandemic very high. But of course, some workplaces were able to increase their revenues. But their numbers are not very high actually. Most of them are grocery stores and food suppliers.
And most of them continued their activities. They didn't shut down. And the rate of shops that carried on their activities is only 5%. And only 7% had layoffs. So most of them believe that the pandemic would be over, and that's why they kept their staff. And there are restrictions on staff layoffs now anyway that came through central government. And also, when we look at shop owners and how they forecasted the future, because that is very important for economic investments. If you can't forecast the future, you don't invest in anything. So how do you see this crisis? What is your forecast about it? We asked this question. 53% believed it would last for longer than a year. And that explains why the economic situation went south. I think it shows us that at the multiple municipality level and also at a larger scale. But despite that, they're hopeful, and 62% of our workplaces or shopkeepers are thinking of expanding in the future. And there are also a group that are considering to shut down their enterprises, but we believe that's not really related to COVID. They would probably be considering shutting down in any case. And when we look at our studies with the public, we contacted 1,206 people, and 52% were happy with the municipal services throughout the pandemic. And there are a lot of people who are indecisive. That's about 30%. But as municipal staff, we consider that a good thing, because if you don't feel the existence of a municipality in a certain district, that means they're happy with the services. We only have 14, 15% who are saying this, that they are not satisfied. So if there are no complaints, the asphalt is good, you're saying. Yes, that's how we consider it. I mean, I guess you would understand this concept as well, working in municipalities. And one of the greatest measurements here is the chronic diseases rate in households. And when we looked at our studies, 30% of the households had blood pressure patients. So 3 out of every 10 households had some blood pressure issues. 2 out of 10 had diabetes, and there were also those with heart diseases, cardiac diseases. So if there's a child that transmits the disease to that household, we had to see what the risk would be. That's why we looked at it on household basis. And then we looked at the income levels. 50% responded saying we had a loss of income or a drastic loss of income. And that's all I'm going to say about the surveys. Now, about our own staff, of course, we conducted some studies in that area as well. We had surveys for 450 personnel and asked them how they were impacted, if our institution was successful enough. And our staff, 28% said the activities were sufficient, and around 30% said it was moderately sufficient, but 50% are saying the services were not sufficient, because at the beginning, in the first 2 to 3 weeks, when everyone was trying to find masks and disinfectants, of course, we had challenges in finding supplies, because they ran out in the market and they became very expensive. And as you know, we have legislations. I mean, for example, they ask for cash payment, but municipalities cannot pay in cash. So we had certain issues with legislations. So the municipalities had challenges in terms of protecting their own staff as well. If we can wrap up, please. Generally, in terms of crisis management, they believe we had a good performance. And we also had interviews with our managers, our leadership team. And when we look at them, the lack of digital infrastructure, busy schedule, and lack of experience were considered as the factor that had a negative impact on municipal activities. And when we talk about lack of staff, there is a lack of headcount, basically, because due to the pandemic, a lot of people couldn't come to work. But the staff that was able to work was working selflessly. I mean, if they are supposed to work for 1 hour, let's say, they worked for 2 hours instead. So with the selfless work, this process was overcome in a more successful manner. All of our leadership team agreed to that. So I'll end my words here. Okay, so we have about 12 minutes left. So 3 minutes for each of our panelists. I know you're all very busy, and the data that you're sharing is very important. Now, I would like to turn to you, Mr. Inan İzci. I'm going to ask you about how you developed this model, please. And by the way, Rashid Kurt from Bağcılar Municipality has asked a question about what municipalities need to do in the short, medium, and long term about this. So if you can keep that in mind as you are answering, that would also be good. And so basically about the process of model development, can you give us some information, please? Thank you very much, Mr. Aslan. Now, the model development, I guess I mentioned it in the first round a little bit. So I would like to focus on the practice, the implementation, rather. I think it would be more beneficial for the viewers. Now, the model encompasses various approaches. I mean, one side is database, then we're talking about smart cities, and then we're talking about disasters and resilient cities. So basically, what we call the model is trying to collect the accumulation of all these different areas and translating that into a better service at the municipal level. So we want this to be user-friendly, basically. Anyone who takes this publication, for example, should be able to get a tangible impression of what this model is and what it does. For example, we talked about being data-based. Now, how many people in our district have diseases and which risk groups are they in? And then second data point is, are they living alone? Then the third data point would be, what is their socioeconomic situation? Do they need social support, or should there be economic support added to that as well? And also, within our institution, who are the people we may lose throughout this pandemic that may not be able to come to work? And also, is it the people who are calling out the most that are getting aid, or is it those that actually have the highest amount of needs? I mean, there could be some people receiving aid because they are quite active in terms of the municipalities and the district municipalities, but are they really the ones that have the highest needs? So in that sense, this model can be used as a tool for municipalities to take various approaches towards such situations. There can be areas that can be improved. For example, we focused on this mostly from the pandemic perspective, but there could be natural disasters, and for that, we may need to further develop this model. And also data sharing, for example. I mean, TÜİK, the Turkish Statistical Institute, needs to be able to provide this data in an anonymous form so we can understand how to approach this. And also, pandemics need to be considered as natural disasters, and the processes and resources need to be prioritized at the legislative level as well. And what we saw that there was a huge social solidarity that was increased. And how can we use the solidarity in other areas in the long term? So in terms of making further developments and empowering various areas. We believe this model will be very useful in various circumstances. And throughout the development of this model, I must say this, Figen Terzioğlu, Ferzan Aşık, and Nuran Ceylan from Sultanbeyli Municipality, and Aslan Akman from Maltepe Municipality, and Mr. Cemil Aslan, Burcuhan Şener, and Merve Ağca. I would like to thank them from Marmara Municipalities Union. They had a huge contribution. Thank you very much. Now, Mr. Erkin İrimez, you talked to us about risk governance models across the world in the first round. Can you give us more detailed information about this specific model so we can be better informed about this model? You only have a few minutes, unfortunately, but if you can just wrap up, please. Now, our model is saying you need to prepare for a crisis with a structure that you prepare before the crisis, and that structure must be sustainable. So, and it also says invite all stakeholders into building the structure. And as you are creating this structure, don't focus on a single risk, try to focus on all potential risks. And at the end of the day, when there is a crisis, you should be able to transit into a working structure rapidly. So, robust data collection is very important. And when you are lacking data, you need to have certain protocols to be able to follow to acquire data. And you need to prepare based on the need of services and how long they will be needed. And creating collaborations is very important because you can't do everything on your own because you have limitations in terms of your mandate, in terms of resources. So you need to be inclusive and participatory and create a roadmap together with your stakeholders. But of course, another thing to keep in mind is that the plan that is prepared cannot be very rigid because the circumstances in the field can change, so it needs to be flexible. And as you know, the resilient cities had, the OECD had a working paper in 2018 about resilient cities, and it clearly says that the concept of resilient cities is not going back to what was before the crisis, but going towards something different after you come out of the crisis. So for that reason, our model is also supporting this concept. And the basic things we are stating here is that we need to include stakeholders, internal and external stakeholders. And as we are carrying out this study, of course, there's another thing that we focus on within the municipality, and that is getting opinions of people about what can be done in a better manner. And the expectations from staff and citizens is that there needs to be a study that is done before the crisis. Everyone has seen that it is not possible to solve the crisis when you start planning within the crisis. So when we plan ahead, it will be much easier to implement. Another very important advantage in this model is that we work together with two strategic development directors, and that's why we know where these can be implemented internally and where activities around the implementation has already started. They actually already implemented some of the features here as we were working on it because they saw that it was beneficial. So we created a roadmap basically. And an important point here, besides all this resilience and flexibility, is that you need to have drills to prepare for a crisis, just the way you would prepare for a football game if you are a football team, for example. You need to have drills so people have an orientation towards where they need to go at times of crisis and what they need to do. So that is something we need to focus on as well. Planning on its own is not enough. And sometimes you may need to make changes during the implementation. And also once everything is over, you need to be able to monitor the changes that take place around you. And as we said, this virus is also an economic virus, and the impacts are going to be around for a while, especially in the service sector. So the municipalities are going to be under a lot of pressure in terms of social aid. So innovative activities in financial areas and mobilizing the resources of other stakeholders takes the burden off the municipalities a little bit, but they can really lead the way because they know their district very well as municipalities. So that is another important output. So the municipality is a development stakeholder, a crisis management stakeholder, and also a stakeholder that increases the living standards of citizens. And when the citizens look at it, what they see is that the municipality is the closest public institution that they can access, and they can state their demands. Thank you very, very much. Now, in 1-2 minutes, we'll hear from Mr. Aktaş and Mr. Keshan. And basically, how are you bringing this model into life, and what are the benefits you're expecting? Very briefly, please, because we have a time crisis. Let's see how you are going to manage this crisis.
Can I steal 1 minute from my colleagues before they start? Go ahead, please. We're fighting with limited resources, and we unite in all the basic aspects mentioned here. We had some challenges in managing this process. What were those challenges? We cannot receive accurate data about the number of cases and their exact addresses, so we cannot work on that information. And to plan for this, you have to allocate enough resources and HR. And according to occupational safety law, you can face a lot of problems when you employ your staff member in a place other than defined in their terms of reference. So I think we have to receive more accurate data and have a more cumulative look. For instance, I'm in charge of cleaning services. If 60% of the people in the cleaning department gets the virus, what should I do? I will have to transfer people from other units, but the law is against me in doing so. I just have to say this so that measures can be taken against this. Well, thank you. Let me quickly go through how we are going to implement this model. First of all, we have to update our strategic plans. In our 2020-2024 strategic plans, the pandemic was not foreseen, but now we are aware and we can foresee. The model output should be put into practice and should be aligned with our strategic goals and objectives. Secondly, within the institution, we have to build further capacity and work further on institutionalization. We will have a 3-pillar strategy for that. First of all, the business processes or business flows of the municipality will be updated by including pandemic disasters. The risks will be redefined. And thirdly, staff policies will be updated within this perspective based on risks, processes, and business flows. We will have more effective coordination and cooperation with other institutions, and we will expedite our information and training activities within the institution as well. This Thursday, Mr. Erimez and Mr. Izci from Arguden Academy will be organizing a training program for our managers, and that will be the first step. And finally, we will attach more importance to data. So this is, in a nutshell, what I have to say. Thank you very much for being precise. Bahadır Bey, could you please elaborate on how you are going to implement this model and what benefits you are expecting out of it? Could you please wrap it up in 2 minutes?
Bahadır Bey sesiniz kapalı mı?
You have to unmute yourself, Mr. Keshan. Excuse me. Okay, I'll be quick. The model is based on planning for pre-crisis, during crisis, and post-crisis periods. We are within the crisis moment now, and considering the third wave and the fourth wave, we are ahead of the pandemic as well. So we first have to coordinate our data infrastructure. Of course, this brings forward the importance of coordination within the organization and outside of the organization. We will focus on what we can do to inform the workplaces and households as well. We will be very active in communicating information. We are planning to coming up with an action plan in that regard. In the upcoming period, we'll be organizing a training session for our managers, and Arguden Academy is going to help us. In building that action plan, we'll take into account our human resources, physical resources, and financial resources. And we also have to think about what can be done in face of a crisis, which brings about emergency planning, and which also brings about organization of a crisis desk. We have participants, international participants. They may not get the structure in Turkey very well. We have the central government, and we have branches of the central government within provinces. We call them district governments. We also have the city municipalities, another part of local administration, but the primary responsibility lies with the district governments, the central government branches. But of course, as municipalities, we also provide services to the citizens. Therefore, we have to coordinate our work with that of the central government. And we will focus more on social services, especially to those who are affected by the crisis. Well, I think I consumed my 2 minutes, so let me stop here. I know you have much more to tell, but we have limited time. Thank you very much. Today, we listened to the project co-organized by Arguden Academy and 2 of our municipalities. The project is about integrated social service governance model after the shock. We listened to Hüseyin Keskin, Mr. Sadi Kara from Maltepe municipality, Erkin Irmez and İnan İzci from Arguden Academy. And we listened to Mehmet Aktaş and Bahadır Keshan from respective municipalities. I'd like to thank our panelists and our participants. We are looking forward to better projects, more efficient projects in the future as well. Thank you very much.